Okay, good. So I'll just go from here, and you'll know that these words are up there, and so don't worry about it. The grand challenges for, so this is healthcare. We looked at the triple aims, which is outcomes, cost, and access, and we gave a couple examples. We had 6 spoke proposals go in the other day, and so we talked about 2 in particular, chronic disease management and how global variation in care can inform us about management, and also substance abuse and how to learn more about substance abuse and address it using heterogeneous data. Another big challenge we talked about was disparities and the observation that technology may increase disparities. It was pointed out that precision medicine may actually create a huge gap in medical care that's never been seen before, where people who have $1 million can cure their cancer, but if you don't have $1 million and the government doesn't have $1 million to pay for you, you will die from your cancer. So can we scale up? Can we use data science to come up with solutions so that we don't create enormous disparities we've never had before? And then talked about another big challenge to address is behavioral change and how we can use various social media and recommendations based on data science to get people to do things. You know, a lot of this stuff like taking the right medication, well, if you just ate less, you know, you wouldn't have type 2 diabetes and wouldn't have to do all this other care that we're going to do data science on. So how do you create behavioral change? So anyway, then we went through kind of the technical challenges, generating evidence. I won't go through details. I want to get to it. I wish we could read that better. Integrating disparate data sources, the genotype, the phenotype, that is people's personal characteristics and the environment, and the complexity of health data, and what are the challenges of bringing all that together to come up with recommendations. We talked about the challenge of engaging the public in science and citizen science, and some of those spoke proposals pulling in citizen scientists to do the research. Big challenge is accessing data sets. We have data in different medical centers. It's the opposite of some of the other spokes. The other spokes, the industry has the data, and academia is trying to get to it. Here we have academia has the data and industry is trying to get to it. So we still want to form partnerships, but it's in the opposite direction for our spoke. Privacy and security, obviously critical, and reproducibility of results is extremely important given the what's at stake. Workshops, we've already have our first workshop is for January 7th, which will be at the New York Academy of Medicine, run by Nabil Adam at Rutgers. There's Nabil right there. And we gave out, hopefully you got a piece of paper announcing that one. It's Data Science Learning and Applications to Biomedical and Health Sciences. And we discussed a set of other workshops. We had proposed an initial set, and now we modified that set of workshops, which I won't go through here to stay within my 5 minutes. And then we talked concretely about partnerships, although the 6 spoke proposals, I think, are our 6 partnerships that we can talk about. Let me go straight to resources. So he's saying, what could the hub do for us? What is a spoke really? If it's an unfunded mandate to collaborate, I mean, how do you do this? And how do you keep 35 people and the other 35 who weren't in the room all together and working together this? Like, it's one thing to come up with a piece of, with a document or a PowerPoint. It's nothing to actually do work. So how the hub could help us? Funding, of course, went first on the list, and we went through that one, by that one pretty quickly. Creating an expertise list with keywords, so when people come in, everyone on the spoke would be on this list with their expertise that industry could come in and find us. Data use agreements, IRB templates, consenting agreements that we can share with each other, storage and computing infrastructure, mechanisms to share spoke tools and services, information resources like spoke status and tweets and newsletters, advertising the spokes, especially using vignettes to improve our relationship with the public and the rest of our field. Matchmaking service of various types, especially graduate student matchmaking with industry and with academics. Building collaboration infrastructure, listserv, starting off with a listserv. Data inventory. We each have these data sources. Let's just find out among these 70 people what data sources they're willing to share right now. And some ideas about how perhaps you can get NSF recognition if you share your data. Like, what brownie points do you get, if not money, if you work on this thing? And then we talked about our spoke proposals. We didn't merge them yet. They didn't make sense. The 4 that were represented in the group, we didn't merge, but they were all good proposals. And we talked about, well, once it's selected, which ones will go forward? Should we be sharing our proposals, helping each other, writing letters for each other, and so forth? That's it.